Hello, Shockers, and welcome to the Student Government Association's virtual town hall. My name is Mackenzie Haas, and I'm the Student Body Vice President. Today, I have the pleasure of hosting Dr. Terry Hall, our Vice President for Student Affairs, Camille Childers, our Director of Public Health Services, and Katie Austin, our Assistant Director of Housing and Residence Life. Thank you all for joining SGA again today in hopes of addressing student concerns and issues on our campus as we all continue to navigate our roles and responsibilities during this academic school year. It's imperative that students continue to have their voices heard in such unprecedented times. And we all know that the situation is fluid and ever-changing, so it's best to continue having these discussions. So thank you guys for being here. And for those who are tuning in with us, welcome. We'll go ahead and get started with a few general updates from each of our panelists. Dr. Hall, would you like to begin with a general update?
Sure, Mackenzie, thank you. So first I want to say to all the shockers out there how much I really appreciate that you're wearing masks. And every time I'm out and about on campus, or I see you out and about on campus, you're wearing masks. And so I really appreciate the commitment that you have to keep others healthy, and by following university suggestions in terms of wearing masks. So that is much appreciated. If by ever chance you ever need another mask, make sure you either stop by my office here in the Radigan Student Center or in Student Government. We have some extra WSU masks. You get it? Like this one if you need some more. So we've been working hard and we've been adjusting. And so there are some really exciting things that Student Affairs has been working on with Student Government that hopefully within the next couple of months we can start unveiling some of the progress that we're making on some key issues for students. Beyond that, we just urge you to stay safe, stay at least 6 feet physically distanced away from folks, and take care of yourself. Thanks, Mackenzie.
Yeah, of course. Okay, Camille, would you like to give us an update from Student Health Services?
Yeah, thanks, Mackenzie. I echo Dr. Hall's sentiment of thank you all for trying to learn how to coexist with COVID-19. Obviously, this has been a big issue for not only the campus, but the state, the county, and the country, and around the globe. So I know it's unusual and uncomfortable sometimes to wear a mask or to physically distance, but these are really the best tools we have right now to help us. So just a little update about student health. We continue to be open to serve students. Again, we're open 8 to 5 Monday through Friday, and we're located in the YMCA on the main campus. You get into the Student Wellness Center where Student Health and CAPS is through the lobby of the YMCA. We put in several safety measures. If you haven't been to Student Health yet, or so far this semester, just kind of a idea of what happens when you come in. We have you wash your hands. We have you change your face covering if you're going to have a visit. We'll give you a fresh mask to wear. You'll notice that the staff all have PPE on of different levels, whether they're going to be checking you at the front desk or whether they're going to be seeing you in the room. You'll see that depending on why you're coming in, people will have PPE on. So don't be alarmed by that. That's a safety measure for you and for the staff. We also want to make sure you understand that the new space we have, which we really love, has allowed us to have enough room so the lobby is separated between well and ill visits. So when you come in, if you're coming in for just preventative care or routine care, there's a space to sit that's separate from those that come in ill. I think it's important not only for yourself, but for your family members. There's been a lot of talk about being afraid to go to the doctor because of COVID-19. I think it's important to understand that there are controls put in place for us to help you be safe when you seek medical care, including at Student Health. So if you need to come in for a physical, if you just have a routine visit you want to make, or you want to update your vaccinations, please don't be afraid to seek health care. All health clinics have controls in place for your safety, and just make sure that you're getting the care you need, whether you're ill or whether you're just going in for routine care.
Awesome. Thank you for that reminder, Camille. And then Katie, could you give us a little update about Housing and Residence Life?
Absolutely. So Housing and Residence Life, we have about 1,200, a little over 1,200 students who call on-campus housing home this year, which is about 200 students less than a typical year. And what that's allowed us to do is have ample spaces held off in each of our buildings for quarantine and isolation rooms. So we've been working really closely with Student Health Services ever since move-in to make sure that we've got good procedures, good policies and protocols in place to manage any situation really that might arise related to COVID-19. So Camille Childers and myself are in constant contact as we navigate these waters and handle any situations that do come up. So we have students who might have had an exposure who are quarantining, students who have maybe tested positive, who are isolating in a space, working closely with our dining services provider to make sure that those students are getting meals regularly, checking in with them, and really supporting them during this unique time. Students are doing a great job with masking. We've been very impressed with everyone's compliance and willingness to, make those measures, do those things to keep each other safe. Housing and Residence Life has started documenting folks, though, if they are not masking at this point. We were doing warnings, just, verbal educational warnings for the first 5 to 6 weeks after move-in. So you may hear that resident assistants are going to take a step further now and actually document an incident if someone's seen in a common space like the Shocker Hall lobby or any of the study rooms with other students and they don't have that mask on. So really trying to hit home that this is a policy and something that we need to take seriously. But overall, it's been really, I've been impressed. Students are doing what they need to do to keep themselves safe. They're taking personal responsibility and making good choices. So we really appreciate that. In a year like this, it means so much to see that the students are, trying to unite and do the right things.
Yeah, it really does mean a lot. Thank you guys for your updates. I appreciate that. We're going to go ahead and jump into the questions that SGA has put together. And I want to remind the viewers that you can comment your questions and we will ask those here as well. So without further ado, how does the university collect the data on the COVID-19 dashboard? Camille, I believe you're muted.
New technology. There we go. Thank you, Mackenzie. The data collected on the testing is the testing that's done in student health. So when student health sees somebody that's experiencing symptoms of COVID-19 or they have a known exposure and we're doing some testing on them, that's the data that's being posted on the dashboard. I think it's important to remember that that testing does not include results from staff, faculty, or even students who seek care off campus or get tested off campus. So just remember that the data that's up there is data from what student health is doing in the clinic. So just remember that those results don't necessarily indicate the whole level of disease threshold that, all the positives on that may be associated with campus are not going to be reported there because we may not be aware of them all.
Awesome, thank you. Just kind of a follow-up for that. How is testing going so far? Can you give us a glimpse into that, Camille?
I can. I think testing is going really well. We are using a saliva test rather than the whole nasal swab up the nose. If you've ever had that, you will greatly appreciate the fact that you don't have to do that when you come to test at Student Health. I think the students like that. The results for this test are also quicker than what we were experiencing with the nasal swab sample. Test results can come anywhere from 24 to 72 hours after the sample is in the lab. So that's been a very much faster turnaround time, which ideally that's what you want, is a time to be able to, that you don't have to isolate. I think it's important to remember that when you are being tested and you're being tested for symptoms, that you will be asked to isolate until you get your test result back. And the reason is, if you're having symptoms of COVID-19 that necessitate testing, you could be contagious. So that's why a provider will tell you to isolate after you get the testing done until your results come in.
So you kind of hit on this, but I just wanted to clarify a little bit. How are students able to get testing on campus and what do those options look like? And is any student allowed to get testing, or are you supposed to be showing symptoms or have been exposed in order to get that test?
Okay, that's a good question. Currently, what Student Health is providing is students that have symptoms that can get tested through student health. And then we are also doing testing with students that have been contacts of a known exposure. That's the testing we're doing at this time. We are waiting to see what our supply chain will be as far as testing supplies, equipment for that. We don't want to, if you overload the lab, then the results take a lot longer. So there are discussions on if we will go to the next step or what the next step will be for testing, whether we'll expand that to asymptomatic testing or not. Currently, any student can get tested at Student Health. We advise you to call ahead. We're trying to cut down on walk-in care because we have a lot of students coming in or needing care. We don't want students having to wait a long time, particularly if they're ill. So we do ask students to call ahead, not to just walk in, but we have appointments available pretty much every day that students can get in and be seen.
Awesome. Thank you, Camille. And just one final question about testing. Does WCU have any plans to do mass testing on campus?
And that's part of the discussion that's ongoing. We did some what could be called mass testing when the Housing and Residence Life did their move-in. So starting in August 7th through the beginning of the first week of school, we did mass testing with all of the housing residents and the staff in the housing. So as far as expanding that beyond that population, Student Health is looking at that along with a small group that's talking about what's the next step for testing and what does that look like on campus.
Awesome. And are there any updates about the testing lab coming to campus from anyone?
Well, hi, Mackenzie. I'll answer that one. But before I talk about the lab, I just want to make sure that students know how great Camille and her staff have been in terms of the response and what they've done, and how they really continue to be student focused during a time when it's been challenging over the last 6 to 8 months. And so Camille is just, makes me proud every day for the kind of work that she's done, and the way that she's interacted with the county and others in the state for us. I'm just really proud. So want to make sure we all thank Camille for the work that she and her staff have done on our behalf. So thanks, Camille. So we are working on developing a lab for campus. As I understand it, it will be up and running by the end of the semester, which then will give us even quicker turnaround time and the results. Things are in process. I think equipment's being sent, and so stay tuned. But I know for sure by the end of the semester, hopefully before then.
Awesome. Thank you, Dr. Hall. And then will students in housing continue to be tested besides the tests needed to move onto campus in the spring? Or no, for this semester, I'm sorry.
I think Camille could probably answer that better than I can.
Well, what we're doing now with housing students, as Katie mentioned, we have students that are in isolation and quarantine. So students that are in isolation for positive tests, you don't really need to retest. But however, students that are symptomatic while they're in quarantine, we're testing those. If you are symptomatic and you're in quarantine, you can put a face covering on and go seek medical care. So students that are in housing can come in and get tested. Again, call ahead, whether it's to Student Health or a local provider. Also, we are starting to roll out a process where if students are in quarantine and they remain asymptomatic, we're doing testing towards the end of quarantine. This has really been beneficial for us to kind of control the disease spread within a contained environment like the dormitory or the residence halls. Those are a little bit higher risk for communicable diseases because they live close. So in those kind of what we'll call congregate or communal living environments, it's important to be able to control the spread of a communicable disease. So students that live in housing that are coming out of their quarantine, we're retesting those at all as well. I want to make sure people understand, students in particular, that currently the testing that Student Health is providing is free to students. So that's thanks to the support of the university and the funding from the government that we've been able to provide that testing for students currently at no cost, which is great because prior to that, the test was about $100. So again, I want students to feel like if they're having symptoms and they think they're gonna, they may have COVID, to really call ahead. and come on in and be seen, and we can help you determine whether, based on the clinical decision-making process with a provider or a nurse, you would qualify for the testing. Also, just one more comment on that. We also can test for other things as student health. We do have a lab and a pharmacy. You'll see that, you've probably seen that some of the symptoms of COVID are very much like allergies, or maybe I have the flu because flu season is coming, or maybe you have strep throat. So we can test for some of those things in the clinic, so we can determine whether you have strep throat. And when flu season starts, we'll be able to determine if the symptoms you have are related to flu. And if it's not flu, then maybe we need to consider doing a COVID test.
Awesome. Thank you, Camille.
Camille, I thought you were going to talk about STDs and those kind of tests as well.
I can talk about that because we have our first P for Pizza event coming up on the 7th of October.
Great events. Okay, so will students living on campus be tested when they return in February?
I know that is a discussion that's happening, and again, that's probably something that Camille is going to be deciding. The committee that meets and talks about a lot of these decisions around COVID is determining that. I think that it's from the residents' perspective, some folks are interested in that since they're going away and coming back. But we will just kind of carry out those logistics working with student health. I know for the fall, they had to shut down the clinic for a little bit, and they had staff over in the suites and in Shocker Hall, making that testing process possible, because again, 1,200 students and every single one of them was tested is quite the undertaking. So Camille, I don't know if there's further discussions that you can share.
Sure, there have been discussions on that. I mean, I think that Katie makes a good point that we're going to be having a large majority of students off campus for a period of time before they move back into their dorm or residence hall. So I think that that's a possible that we're looking at right now. The one good thing about this testing process that we've done is that we now have the ability for students to do what we call a self-collection. So part of that discussion of whether or not we test is what that would look like, how we would set it up. So yes, short answer, those conversations are going on. And once we know, we will let students know. That decision, I would assume, would be made prior to students getting to the end of the semester.
And Mackenzie, if I can add, students don't have to leave over break. If they want to stay in housing, we will be open over the entire break period. So students will just be opting into that this year. In other years, the contract kind of carried through. We had reduced the cost of the contract and taken out that piece since a lot of students will be leaving, but they can opt in. It's broken into 2 intercession contracts that are about a month each for that chunk over winter break. But students, again, they have that ability to stay on campus still.
Awesome. Well, thank you for that. And then will students have to quarantine for 2 weeks when they return in the spring if they do end up going back home and come back to the residence halls?
In the fall when that happened, that was because they had been in a location that was listed on the CDC travel guidelines website or the KDHE website. So we'll take the guidance from Camille, but at this point in time, there are no states listed as hotspots where folks, if they're coming from there, need to complete a quarantine before arriving. But that list is constantly being updated. So if that changes, we'll follow those guidelines. International travel, we'll wait and see if there are certain guidelines about having to quarantine if they're coming back internationally. But again, that's really dictated to us through the Kansas Department of Health and through our student health services folks. Camille helps interpret all that for us and tell us what we need to make happen. But we're prepared to do that if we need to. We've got the capacity and the space and the resources to quarantine students if they need to.
Hey, Mackenzie, if I could add, one of the things that makes our housing situation a little bit different than other campuses is the fact that certainly the oldest of our buildings is 5 years old, but we don't have communal bathrooms. And so because the Shocker Hall is all suites, because the flats and the suites are such as they are that the most that any students would share a restroom would be 4 people. And in most of our cases, we have 2 or fewer that are sharing a restroom. So it really helps stop some of the spread that might take place on other campuses, because we don't have the residence halls there where 30 or 40 students are all trying to share one restroom. And so it's a good situation we're in because of the housing that we have on campus.
Yeah, that makes a lot of sense. Thank you. So, what was the reason behind the decision making in regards to asking faculty to not share that someone has tested positive for COVID when they're told that a student in their class has tested positive? Can somebody explain that a little bit for students?
Are you waiting for me, Camille?
I would be happy to address that.
Well, so I'll start and then
Go ahead.
Camille can tell me if I'm, she can correct me, but it's a privacy issue, right? And so, we're guided by HIPAA regulations. And so, we can't say that someone's sick, and we certainly can't announce that someone's sick. And so I know that there's some students that believe, the university is withholding this information from us. And certainly we're not trying to withhold information, but we are trying to protect the rights of our students to have some privacy with their health. And so that's why we can't have faculty announce that students are out sick, because it's for those students' individuals' privacy.
I think part of that too is that Kansas is very unique in its how we approach and the terms of contact tracing and the notification of particularly COVID-19. The Kansas legislature, I think in June of 2020, passed what they called House Bill 2016. Now, this legislation had included in it a specific COVID-19 Contact Tracing Privacy Act. This act changed how COVID-19 contact tracing and notification is done, specifically for COVID-19. So the only people, according to this law, and this is a Kansas law, that can do contact tracing are Kansas Department of Health and Environment, or KDHE, and the local health departments, such as in our county, Sedgwick County Health Department. Only these entities can contact trace. So it's not that we're not doing it or we don't want to do it. We legally cannot do it. So currently, when a student is identified, particularly in housing, or they complete the COVID-19 report form and they self-report, or they're in housing and they report that they're a contact or that they've tested positive, we help facilitate them as far as facilitate their quarantine or isolation period, as far as helping them determine when it might end based on the process of when they were exposed, whether the person was symptomatic, things like that, and try to help them understand what quarantine and isolation is. We provide them education, but we are not contact tracing because we're not legally allowed to do so. I think it's important for people to understand that under this act, contact tracing has its own definition. It's not, Kansas is different than other places in the country. We can't do it by law.
So if contact tracing is going through the county, how long can students expect to wait before they're told if they might have been exposed? Do you have that information, Camille?
Well, the way that this works currently on campus is we do encourage those that test positive. Part of the conversation I have when a student tells me, or a student that we are informing are positive, is we ask them to consider who they might have been around by the definition of a close contact within the period of time frame that we know our local and state public health consider it transmissible. I'll give you an example. We have a student that lives in housing that came to see us, and they tested because they had symptoms, and 2 days later we found out they were positive. When they went back to housing, first of all, we contacted Katie. Katie and I have daily contact, and said so-and-so needs to be self-isolated until they can get their test results back. Now so what the dorm or housing staff does is they will move the student to a location where they can self-isolate until they get their results back. When the results come back, if they're positive, I will call them and explain to them their test was positive, what that means, answer their questions. Part of the education we provide is that they need to identify to themselves and contact anybody that they would have been around 2 days prior to they were ill, or 2 days prior to their test if they were tested and they were asymptomatic. That is as much as we can do. And I also encourage them to either call the health department or to contact those individuals themselves and ask them to call the health department. So that's how students are notified. The county has the responsibility, the health department has a responsibility to reach out to the individual that tested positive and to ask more detailed questions about who those individuals are. They can get names, they will ask for contact information, those kind of things. We do not do that because we're not allowed to do that. I think it's also important to understand that this new COVID-19 Privacy Act also allows an individual to state that I don't wish to have my contacts divulged. And that is now within their legal rights to do so. But as a nurse and as a citizen, I would hope that people who have a communicable disease that could harm others would be willing to share that information so we can stop the spread of COVID.
On that same note, so then what often happens in housing is, someone else there might contact us and say, so-and-so called me and said that they had COVID and that we have been close contacts. So they basically self-report to us as a exposure, and then we will move through the process, having them talk to Camille again. So it's still happening, and we are considering roommates automatically close contacts, of course. But yeah, it's just happening in a different way, like Camille said.
Awesome. Thank you, guys. Terry, what is being done about student groups who are violating guidelines, if anything?
Well, we're very concerned about that as well. So what if an incident report comes in that says, XYZ had a function that violated policies or didn't register, then we're following up with the group through student involvement and student conduct as we're able to. We're also, there are times when students are doing their best to try to live within the guidelines, and then yet could still use some improvement. So we've actually visited events to help make sure that things are happening the way that they're supposed to. We've also had follow-up conversations with student groups about how to do things better the next time. We're coming at this from the standpoint that, everybody is trying to do their best, but folks also just are tired of not being with others. And so we're trying to work with student groups and others about how can you have events and be safe. And we're trying to be educational much more than we're trying to be punitive in terms of working with student groups. Certainly, we're very concerned of if students are at a function or go someplace and they're concerned about what's happening, to please let us know that, to email me, to put in an incident report through student involvement or through student conduct, so that we could follow up and make sure that we all are doing all that we can to make sure we stay safe.
Yeah, that's all we can do. Thank you. Are there going to be any new or updated policies regarding mask wearing or social distancing in the spring?
I think we've just done the most recent updating to the mask policy in terms of, fleece neck gaiters and the masks that have the breathing things in them as seen as not being the most effective by CDC guidelines. But beyond that, I don't know that we'll do much more of an update to that policy. I think we're pretty happy with where we're sitting with it. But certainly if that's what happens, we'll communicate with students. And, we're always open to feedback. If students see a pattern or see some issues in terms of masks and mask wearing on campus, to please let us know that. And if there are updates that students could suggest to make our campus even safer, then we're always open to that feedback. And so to please let us know if they have some ideas that would make campus safer.
Awesome. Thank you. And will there be any events or programs on campus or online after Thanksgiving break?
Probably not in person for sure after Thanksgiving break. There might be, if we have a series of programs such as, Men of Excellence or some of the things we're doing about leadership development, if it's an ongoing series of programs, then there might be some of those virtual programs that still take place after Thanksgiving break. But, we traditionally kind of slow down things anyway after Thanksgiving break, because students, really, there's a week of classes and then there are finals, and we know that students are otherwise focused on getting the great grades that they need to get. And so it's traditionally a fairly slow time for us in terms of events, but we will be wrapping up things prior to the 20th with just maybe a few loose ends after Thanksgiving break.
And Mackenzie, I would say from a housing perspective, we're really going to look and see how many students opt in to staying for the different intercession breaks, and that's going to kind of determine what we do. We will definitely be staffed throughout that whole time. There's always an RA on call in every building, and a professional staff member on duty every night as well. Even Christmas, we're here, but we're going to look. So we have plans when we roll out these applications for folks to opt in to staying, to follow up with every single resident to find out what their plans are over the extended break, so that we know who's here and who's not, and we can, plan accordingly, working with dining services to make sure there's options available for them, and making sure if we've got a big chunk of students sticking around, what can we do for them while they're here to support them. A lot of folks do have jobs in Wichita and they're sticking around to keep working, and we totally get that. So we'll continue to be there to support them.
Awesome. Thank you both. And have there been any decisions about classes and classroom protocols for spring semester yet?
We're where we are at. That was really eloquent. Sorry. So we know that classes will start on February 1st. We'll use the kind of guidelines that we currently have in place. And frankly, if there are going to be changes, we'll communicate those ahead of time to students as we're able. February 1st is going to be part of flu season. I mean, we're heading into flu season now. And so, how is the regular flu season going to merge and intertwine with COVID-19? We're yet to know. And so we ask students to continue to have some patience and some grace for us as we do our best to keep the university open and running, and also keep focused on students' education and their experiences as best we can, because students are the most important thing and to us, and why we're making our decisions right now is that we want to make sure that students are getting a good education, but we also want to make sure that we're doing our best to keep students safe and healthy along the way.
Yeah, thank you. So with the announcement of basketball coming back, what is it going to look like in Charles Koch Arena, if any of the details are ready yet?
No idea, but I will tell you that I'm as excited as I know my colleagues are on the screen here, that it's great that we'll be able to have some basketball. I know that our rowing and our bowling team are hoping to have have a schedule in the spring semester, since then normally they'd be having some tournaments and some events in the fall, but those have all been pushed back to the spring. So we're hopeful that those two teams will get to will start to operate, just as I'm sure that our friends in athletics are hoping that the spring semester is a much better time, so that some of the delayed sports from the fall that can take place in the spring, and that maybe baseball will be able to take place as it normally would in the spring. But I'm an optimist about these things, and I'm hoping that we'll get back to more normal than we are currently sometime sooner rather than later, but only time will tell.
Awesome. Thank you, Dr. Hall. And If we get a vaccine, will the university require everyone to get vaccinated? If we require a vaccine for everyone, will they provide it free to all students, faculty, and staff?
I'll take that one.
Thank you.
Well, that's a really good question. You know, in past times, the federal and or state government have a process that's called point of dispensing. Typically, emergency management and public health work together in the event of, let's say there was, I don't know, a pandemic, and we needed to get a vaccination to a lot of people. They would use this point of dispensing to set up set locations where either a company does all of their own staff and families, or they're open to the public and individuals can go there to get their vaccination or their medication. I have not heard for sure that that's how the vaccine will be distributed. And I honestly don't know if there will be funding from the federal or state government to cover the vaccine. In an ideal world, because we're in the midst of a pandemic, a global pandemic, you would hope that there's going to be some support put in place to help the people of the world fight COVID so that we can get vaccinations done. As far as mandating vaccines, that gets a little trickier because some people have a religious or personal or medical reason why they can't get a vaccination. So when you start talking about mandating, you also have to have a waiver process in place for those that have an objection or a reason to not get it. So again, short answer is yes, I hope so as a nurse and a healthcare professional, but the reality is we need to wait and see if the support financially is there, and then mandating is gonna, it's probably a personal choice more than a mandate.
Awesome. Well, thank you guys. We are at time to wrap this town hall up. So thank you all for being here. Thank you everyone for watching. And I would like to urge anybody in the audience, if you continue to have questions, to send them to SGA, and SGA will find an answer for you and reach out to the right people and get you connected with those answers. So thank you everyone who submitted questions and tuned in for today's virtual town hall. And as we continue to work throughout this semester, please don't hesitate to reach out to myself or anyone else here in SGA. And thank you again to our panelists today. I hope you all stay safe and happy and healthy, and remember that we're all Shockers United.